To mask up or not? Unmasking the myths. As Nigerian states reopen from stay-at-home orders, the government has announced that it is beyond mandatory for people to wear face coverings in most public spaces to reduce the spread of COVID-19. New information is also emerging every day on how the new coronavirus spreads and the best ways to protect against COVID-19. The most effective protections include washing your hands frequently with soap and water and practicing physical distancing. However, wearing cloth face masks or coverings in public when physical distancing can't be observed does offer protection against spread of COVID-19.
Areas with widespread transmission, WHO advises medical masks for all people working in clinical areas of a health facility, not only workers dealing with patients with COVID-19.
The use of public face masks for the prevention of COVID-19 remains controversial. The WHO initially indicated that it couldn't recommend for or against public use of face masks, as there are yet no clear evidence that the practice is effective in the prevention of COVID-19. The WHO later stated and emphasized that the use of masks alone is insufficient to provide an adequate level of protection and other measures should be adopted. The Nigerian government has begun reopening the economy even though we're seeing upswings in the coronavirus infections rate in many states, Lagos being the epicenter. The rush to reopen the economy has many people overlooking the threats of the virus and returning to their daily routines. The only tool that will protect against a second wave of the virus is maintaining the behavioral modifications of keeping safe, as it is clear that COVID-19 is spread from person-to-person contact through respiratory droplets between people in close contact by the infected person sneezing, coughing, or even talking. Wearing a mask won't necessarily protect a person from catching the disease, but it serves two purposes. The mask restricts an infected person's ability to put droplets into the environment to infect others. And secondly, wearing a mask limits two access points, the mouth and nose, from viral entry to another person. The mask is not a complete solution as it leaves the eyes unprotected. However, it is believed that wearing a mask while following other recommended physical and social distancing behavior will provide sufficient protection and help lower the transmission rate of the disease. Finding out whether face masks indeed reduce the spread of COVID-19 is thus important. Against the available evidence from clinical studies or previous pandemics, we ask, can we really identify a significant effect of face masks on the spread of COVID-19 by looking at the development of registered COVID-19 cases? Yes, we can. Let's look at the case of Jena, a town of 110,000 inhabitants in the federal state of Thuringia, Germany. Jena presents a unique case in Germany as the obligation to wear face masks in public transport, shops and workplaces was introduced much earlier there, dating to 6th of April 2020. The introduction of obligatory face masks was accompanied by a public campaign which started 1 week earlier to make the local population aware of this novel measure. If we look at the number of COVID-19 cases in Jena, masks seem to have a positive effect. The number of registered new infections fell to almost zero in the days after masks were introduced. Another compelling case also suggests that masks can prevent transmission in high-risk scenarios. In one case, a man flew from China to Toronto and subsequently tested positive for COVID-19. He had a dry cough and wore a mask on the flight, and all 25 people closest to him on the flight tested negative for COVID-19. In another case, in late May, two hairstylists in Missouri had close contact with 140 clients while sick with COVID-19. Everyone wore a mask and none of the clients tested positive. As part of a comprehensive response to the COVID-19 epidemic, the President of the Federal Republic of Nigeria recently announced mandatory wearing of face masks by anyone going out in public. The Nigerian Center of Disease Control (NCDC) indicated that the major rationale for public wearing of face masks is to prevent those who are infected but asymptomatic from spreading the virus. The NCDC also emphasized that wearing of face masks may only be effective in preventing the transmission of SARS-CoV-2 if they are worn and disposed appropriately and if mask wearing is combined with other preventive measures such as hand hygiene and social distancing. Unfortunately, new face mask policies are leading to widespread misuse and abuse of face masks in Nigeria. The Nigerian media is awash with images of members of the general public, including healthcare workers and government officials, wearing face masks on their jaws and neck without covering their mouth or nose, or covering only their mouth while the nose is left opened. Many people who use face masks are commonly observed to pull down their masks to their jaw to talk and then pull it back over their mouth and nose after talking. A variety of cloth masks of doubtful efficacy are hawked on the streets and tried by different wearers before deciding on purchase. People are also observed to repeatedly touch the front of their face masks in a bid to adjust the mask, to remove it, or during reflex touching of the face. Some wear one mask for prolonged periods without replacement when it is wet or soiled, which totally defeats the whole purpose of wearing a mask. How do you take them on and off safely? Before putting on a mask, clean your hands well with soap and water. Cover the mouth and nose with your mask and make sure there are no gaps between your face and the mask. Avoid touching the mask while using it, and if you do, wash your hands. Replace the mask when it is damp. To remove your mask, take it off using the elastic tags without touching the front and discard immediately into a closed bin, or if the mask is reusable, directly into the washing machine. The controversy of face shields. It is not known yet if face shields provide any benefit as source control to protect others from the spray of respiratory particles. Does not recommend use of face shields for normal everyday activities or as a substitute for cloth face coverings. However, if face shields are used without a mask, they should wrap around the sides of the wearer's face and extend to below the chin. Disposable face shields should only be worn for a single use and disinfected after each use. It is as well noteworthy that if you are sick with COVID-19 or think you might have COVID-19, do not visit public areas. Stay home except to get medical care. As much as possible, stay in a specific room and away from other people and pets in your home. If you need to be around other people or animals, wear a clothed face covering. Please note that children under the age of 2 or anyone who has trouble breathing or is unconscious, incapacitated, and otherwise unable to remove the mask without assistance should not wear clothed face coverings. As we reopen and get back to some normalcy, think about the way things were for the last 90 days. If you want society to stay open, to continue eating out at your favorite spot, to enjoy gathering family and friends over grills and pepper soup, or to enjoy your favorite local bar, please wear your mask. It is one of only a few tools we have in this pandemic battle. Avoid close contact with anyone who's not wearing a mask, and if you must be in close contact with someone who's not wearing a mask, a face shield may provide some additional protection. Remember, social distancing and wearing a mask works. The data in this documentary proves it. Stay safe out there, guys.
Let's go! The money you take on police, me the laughing gun.